everyone. Thank you for being part of our day, and we really appreciate your viewing time. Today, we're going to be talking about umbilical hernias, and we're going to have Dr. Aluko give us information about that. Thank you, Dr. Aluko.
Okay. Hello. Umbilical hernias are protruding outer like it's caused by a weakening of the anterior abdominal wall muscles. So it's when there is a defect or a slight opening in the anterior abdominal muscle, and it's usually around the umbilicus. We all know where the umbilicus is. So it presents in a way like the intestine goes into the opening and then start to protrude into the skin. And this is in some people it might be a small defect, and in some people it might be a large defect. So umbilical hernia can go for years without it like being problematic, but there are things that we should be on the lookout for to know when to get an umbilical hernia closed. Okay, so firstly, if there is a change in the size of the belly button, which means that more of the intestine has gone inside, and that's putting the intestine at risk of strangulation, and that would like that strangulation is when occurs when there's no blood supply to that part of the intestine anymore, and then that would cause the child to start to vomit. It can become infected, and the child has a fever. So usually when the child starts to have an abdominal pain, that's a sign that this umbilical hernia might need to be treated. So typically when you present to your doctor, when after that the doctor will send you for an x-ray and like some investigations to find out like what's going on. If when the doctor sees this and sees your results, you're referred to a pediatric surgeon, and the pediatric surgeon would give you a plan on how they are going to go forward. So there's a conservative treatment, which is the watchful waiting. So we wait to see if this can only happen if strangulation has not occurred, and if it's just telescoped, it's just inside the space that the defect that is opened. So if it goes back inside, all well and good, the child can go on living a life like with his or her life with the defect. But if it's strangulated, then they will have to do a surgery, which involves like making an incision and closing up the defect. And not in children, like mostly in ladies and girls, they will want it to be like closed up because they don't want the big belly button. They want to wear like bikinis to show the belly button, and they won't want, so it can cause like I've seen children that are bullied because of their belly button. Because I think I had someone in my class that had like in primary school, and he was bullied. He was even a guy. He was bullied because they were pressing it from the school uniform.
Oh, wow.
Yeah, children can be mean, but so like most people get it like fixed because of the mental thing that it can cause them, like can cause it to them. But like inguinal hernia is a very umbilical hernia. I'm so sorry. Umbilical hernia is a very treatable defect that once it's treated, it can either be treated with a mesh, or it can be closed up. So once it's treated, the quality of life returns, and the child has a normal long life. But the goal is to ensure that it's not strangulated, like no strangulation. So because if there's strangulation, they would have to open up, they will have to do a laparoscopic procedure, open up the child, reset,
Major
yeah,
surgery.
a major surgery, cut it, and then sew it back. So it just makes more sense that when the defect is small and it is not causing problem yet, it just makes sense to close it up. And typically a umbilical hernia should close up before the age 3. But if it doesn't close up before age 3, then it's a defect that is going to be there for a while. And
Oh, you mean after, if they're still having it
if they
after
they're
3?
after having it after
Yeah.
age 3, that's when the parents should look into closing it up, so that the child's quality of life and will not be tormented by colleagues or bullied. So but that's just it. Umbilical hernia is treatable, very treatable, and the child can return to their normal self. Thank you.
Wow. Thank you so much. Would you like to add anything, Dr. Vincent?
Okay, yes. Um, I would like to point out one important factor that could worsen this, which is anything that causes raised intra-abdominal
Pressure.
pressure. So you would want to give your child fruits and vegetables to avoid constipation and strain while pooping, which can, like I said, raise the pressure in there and force those intestines to push out through that defect in the abdominal wall. Yeah, that basically is what I want to add to this.
Oh, those are very important points, because umbilical hernias here in Nigeria is more common than elsewhere. I mean, I remember growing up and I would see a child with that out. In America, it's called outie.
Puff,
And it's like, yeah, what do you call it?
puff, puff.
Puff, puff. What else is it called?
Oh, well, I'm just
Puff, I
hearing
know.
that.
Puff, puff, and outie. And it was like, whoa, I'm looking like, whoa, because sometimes, especially I went to Federal Government Girls College, and we had to wear belts. And you just see this, some of our girls trying to push their belly down with a coin, trying to push it down just so that, and I just felt sorry for our colleagues. It's like, wow, why don't you just go and get it fixed? And this is when we were all young, because to me, it was anxiety provoking. We talked about anxiety today also. It was just a form of anxiety that wasn't necessary. So just like you said, mom and dad, your child has an umbilical hernia. Don't wait until they're 15 years old and everybody's laughing at them. Yes, and most parents will say, yeah, I had it and I never had it fixed. That's in the 1970s and 80s. Now we're in the 2020s. Children don't have to deal with that. So if you can get it fixed, just go to a teaching hospital. I think they'll be, or just go to your doctor and they'll be able to direct you on where to go. Thank you so much for listening. We really appreciate you, and we'll see you next time. Thank you, Dr. Vincent. Thank you,
Thanks.
Dr. Aluko, and we appreciate you. All right. Thank you. Bye-bye.